Back on our show this morning, this Tuesday morning, great to have Dr. Bruce Wallace with us, Wallace Eye Associates. They're offering free cataract screening right now. So Dr. Wallace, welcome.
Thank you for having me on this morning. Yes, this is our fourth year. This is recommended by the American Academy of Ophthalmology. This is National Cataract Awareness Month in June.
Yeah.
And so we offer free screenings to determine in this population of patients that's higher risk, whether they need to look into it further with a more thorough eye exam. So this is just a chance for them to find out how they're doing.
Let's focus on cataracts for just a second. What are cataracts?
Cataracts are cloudy lenses inside the eye. And for many patients, this is a gradual change, and that's one of the reasons for the screenings. Many people don't even realize their vision has become like blurry. I've examined many patients that really wouldn't pass a driver's test. I know it's going to be frightening for all of us to think about that because they just weren't aware. It just takes so long for them to develop, and they just kind of adjust to the changes.
Yeah.
So who's most at risk?
I would say older age population, people over the age of 50, 55. Some of the early symptoms are trouble driving at night. I'd say that would be the most common first symptom, and where it can be even dangerous for patients or people to drive with cataracts at a certain stage.
How do people get cataracts?
Well, it's a natural aging change of the lens in the eye. There are traumatic cataracts. You can have babies can get cataracts. There are exceptions to that, but typically it's just an aging change.
So, Go ahead,
well,
Trevor.
if you find out that you do have cataracts, what's the best route to go?
I will tell you that we're extremely fortunate to be living at this time in the history of cataract removal. You know, I started doing cataracts. Patients were in the hospital 3 to 5 days. They wore very thick glasses afterward because we didn't have implants approved in the United States. And now it's just the opposite. People that come in that wear glasses and are very dependent many times are not nearly as dependent after cataract removal because we can match the power of the lens to that eye and allow patients to see better. So we take the cloudy lens out and put a clear lens in.
So it's really become a popular
It has become
and
popular.
easy surgery.
It's much more predictable. It's now obviously outpatient. You don't have to stay in the hospital. And at least at our center, you don't have to change clothes or wear an eye patch when you go home.
Yeah.
And for the patients that have one good eye, can you imagine how important that is to them?
Oh gosh, yeah.
And we have many patients that once they have that first eye done and they have both eyes working, come in and can't believe how bad their vision was because they can compare it with the other eye.
And then say,
the basis for comparison. Yes, how great. So it's really a life-changing experience for many people.
Yeah. And besides here, you've done it all over the country.
Well, actually, I represent our team, and I've been actually not all over the world.
All over the world?
I've been invited to China twice for presentations, Australia, all over Europe. So I've been very fortunate in my career. I'm a clinical professor at LSU and Tulane Medical School, so I do a fair amount of teaching and have been for many years.
So this is a topic you're very knowledgeable
Yeah,
on.
well, we're very fortunate. I've developed some instruments that are sold internationally, and so yes, for the size community we have, it's unusual to find a team that is this well known internationally.
Exactly. Okay, if somebody's interested in this free cataract screening,
that's right. They contact our office, and we'll try to make it as convenient for them as possible. We haven't decided to extend the time frame 2 weeks because of this program. I want to allow people to have another chance since we're later in the week. Excuse me, in the month.
Right.
And so for the first 2 weeks of July, we're also allowing for patients to come in for free screenings.
Super. And what are the hours again, Wallace Eye Associates?
Typically 8:30 to 5.
All right, Bruce, thanks for coming.
Glad to be here, Mark. Trevor, pleasure. Thank you for inviting me.
No problem. Enjoyed it. Thanks, Bruce.
Thank you.
And more to come on our show. We're going to visit with Jeff Hall, talk about the session when we return.